The permanent premolars. The permanent premolars are 8 in number. We have 4 in each arch, 2 in each quadrant, the first and second premolars. Premolars are considered intermediate teeth between molars and canines. They erupt between 10 to 12 years, and in many instances they develop or erupt before the canine. They are considered succedaneous teeth because they replace the primary first and second molars, so there are predecessors for the premolars. Therefore, they are considered succedaneous teeth. What are the common characteristics of premolars in general, whether maxillary or mandibular? These are called the class traits for premolars. First, the premolars are developed from 3 buccal lobes form buccal cusp. These are the 3 buccal lobes which form the buccal cusp, and 1 lingual lobe form the lingual cusp, except the mandibular second premolar. The only exception for this is the mandibular second premolar, which is developed from 5 lobes. 3 buccal form the buccal cusp, and 2 lingual form the 2 lingual cusps. Premolars, as mentioned earlier, the premolars are of 2 types, first and second. First, the premolar is much more like a smaller canine, while the second premolar is much more like a small molar. So, whether maxillary or mandibular, the first premolar, this is a maxillary first premolar and this is a maxillary second premolar. The first premolar has a buccal cusp which is long and sharp. Therefore, they assist the canine, whether maxillary or mandibular, in its function of tearing. While the second premolars, whether maxillary or mandibular, have cusps that are less sharp and less pointed, make them more efficient as grinding teeth, much like molars. All premolars have single root, whether maxillary or mandibular. This is the mandibular first premolar, except the maxillary first premolar, which are frequently bifurcated. Only the maxillary first premolars, in most cases, 80% of the cases, have 2 roots, buccal and palatal or lingual. Permanent maxillary premolars. Maxillary first and second premolars resemble each other so closely. They have the same average dimensions and supplement each other in function. So what's the function of maxillary premolars? As mentioned earlier, premolars assist canines in piercing and tearing food with their sharp cusps. These are maxillary first and maxillary second premolar. So the first premolar mainly resembles a canine and assists in tearing food. They also assist molars in grinding food during mastication because of their occlusal surfaces are broad and they have prominent cusps. They help to maintain the height of the lower third of the vertical dimension of the face. The vertical dimension of the lower third is the vertical distance from the base of the upper lip to the lower border of the chin. This is called the vertical dimension of the lower face. So the presence of posterior teeth in general, whether premolar or molar, help to keep this dimension. If there are loss of a large number of teeth, the patient face will collapse and the patient will have reduced vertical dimension. Premolars reinforce aesthetic during smiling. They do so less than the anterior but more than molars. If you smile, you can see that your maxillary premolars are visible during smiling. Therefore, presence of sound premolars will make your smile more aesthetic and pleasant. The identification features for the maxillary first premolar. These tooth have some unique characteristics. First, the maxillary permanent first premolar has 2 cusps, buccal and lingual. Both cusps are sharp and well defined, but the buccal cusp is 1 millimeter longer than the lingual cusp. The difference is 1 millimeter. The occlusal outline is angular and the buccal outline is prominent. As you can see, it resembles, from the buccal aspect, it resembles a smaller canine. The mesial slope of the cusp, this is the mesial slope is longer than the distal slope, which is the opposite situation for that present in maxillary canine. This tooth is the only tooth in the dental arches that have a developmental concavity on its mesial surface. This is called the mesial developmental depression. This is, as you can notice here, is a depression or concavity present on the mesial aspect of the crown and root, extending from contact area through the cervical area and then to the bifurcation area of the root. Also, this tooth is characterized by the presence of what's called the mesial marginal developmental groove. This is the marginal ridge, mesial marginal ridge, and here it's notched by a small groove called the mesial marginal developmental groove. The maxillary first premolar, characterized by having two roots, in most of the cases, in 80% of the cases, with two pulp canals. The bifurcation is at the middle third of the root. However, in 20% of the cases, the tooth is presented with a single root, and also it will have two pulp canals, even if it has a single root. You can notice here the mesial developmental depression, which is very noticeable in this tooth or on this tooth. Detailed description of the maxillary first premolar from all aspects. Instead of the labial aspect for anterior teeth, the facial aspect of posterior teeth is termed the buccal aspect. So from the buccal aspect, the tooth appear very similar to the maxillary canine. This is the maxillary canine and this is the maxillary first premolar. However, the crown is shorter, as it's noticed here, is shorter than canine and slightly narrower. Difference in length is about 1.5 to 2 millimeters. The maxillary first premolar is 1.5 to 2 millimeters shorter than maxillary canine of the same mouth. The general outlines of the crown and root. This is mesial and this is distal aspect. The cervical line has less curvature than curvature found in the anterior teeth. Mesial outline is slightly concave below the cervical line, then become convex at the broad mesial contact area, while the distal outline is straight below the cervical line, then it becomes convex around the distal contact area. At nearly the same level mesially and distally, in the mesial aspect is located just slightly occlusal to the center of the crown. This is the center of the crown, so it's just slightly occlusal to the center of the crown. Distally, it's located slightly a little bit more occlusal, but it remains somewhat in the same level compared with different position of contact areas between mesial and distal aspects in the anterior teeth. Maxillary first premolar, unlike the canine, is characterized by having a mesial slope which is longer and straight compared with the distal slope, which is more curved and shorter. The tip cusp of the buccal cusp is located slightly distal to the bisecting line of the buccal surface of the crown. So if we draw a line that bisects the crown from the buccal aspect, we can see that the cusp is located slightly distal to this line. Regarding the surface anatomy, first, the relative dimensions of the crown and root. The maxillary first premolar, like the maxillary canine, shows the difference between, or shows the following characteristic. The difference between the mesodistal diameter across the contact areas is 2 mm more than the mesodistal diameter across the cervix, just like canine. The root, however, is similar in its outline to the root of maxillary canine, but it's shorter by 3 to 4 millimeters. Both the crown and root surfaces are convex at all points. In addition, the maxillary first premolar is characterized by a well or strongly developed middle buccal lobe. This is the line of demarcation between the three lobes, so this will result in the formation of buccal ridge, which extend from the cervical line to the tip of the buccal cusp. Here we have the mesiobuccal lobe, this is the middle buccal lobe, and this is the distal buccal lobe. We have slight depressions to the mesial and distal of the buccal ridge, which denote the demarcation between these three lobes. Regarding the lingual aspect, outlines, the cervical, mesial, and distal outlines are the reverse for those seen from the buccal aspect. The main feature is that the crown tapers toward the lingual. So the crown shows lingual convergence. It's narrower lingually than it's buccally. Regarding mesiodistal dimension, because the lingual cusp is narrower mesiodistally, as you can notice here, compared with the buccal cusp. Why? Because the lingual cusp developed from single lobe, not like the buccal cusp, which is developed from three lobes. The lingual cusp is spheroidal in shape, so it has less prominent outline compared with the buccal cusp, and it's 1 millimeter shorter than the buccal cusp, as mentioned earlier. Therefore, from the lingual aspect, the tip and the slopes of the buccal cusp can be seen. We can see the mesial, this is the mesial and distal cusp slopes and the tip of the buccal cusp from the lingual cusp, because the buccal cusp is longer than the lingual cusp. The lingual outlines, as mentioned earlier, are not as prominent. The lingual aspect of the crown is smooth and convex at all points. The same applies for the lingual aspect of the lingual root if two roots are present, or lingual aspect of the root if single root is present. These are smooth and convex at all points. In the next lecture, I will continue discussing the remaining aspects of the maxillary first premolar and also the detailed description of the maxillary second premolar.